A study published in the Journal of Clinical Endocrinology and Metabolism tracked 1,800 men over 60 for 5 years. The researchers were looking for the single strongest predictor of morning erection loss, and what they found was not alcohol, not medication, not testosterone decline. The number one predictor was a cluster of behaviors men perform in the 2 hours before bed. Ordinary, harmless-seeming habits, things you almost certainly did last night. And the mechanism by which they destroy morning erectile function is one most urologists never explain to their patients. I'm Dr. Emily Carter, a board-certified urologist with over 12 years of experience helping men over 60 restore their sexual health and vitality. When men come to me about losing their morning erections, the first thing I do is show them what the research actually says, because the evidence almost always points to something they were doing themselves without knowing it every single night. If this video is already answering a question you've been carrying quietly, hit that like button right now. It helps me reach other men who are searching for real answers. Subscribe to this channel because what I'm going to share over the next few videos may be the most important men's health information you've come across in years. And leave a comment below. Tell me what time you usually go to bed and whether you watch TV or scroll your phone before sleeping. I'll explain exactly why that matters in just a moment. Before I walk you through the specific mistakes, I need you to understand what a morning erection actually is, because most men don't know, and without this foundation, the rest won't land the way it needs to. A morning erection, clinically called a nocturnal penile tumescence event, is not caused by a dream or by arousal. It is produced entirely by your autonomic nervous system during REM sleep. Your parasympathetic nervous system floods the penile arteries with nitric oxide, causing full vasodilation and complete engorgement. This happens 3 to 5 times every night in healthy men, regardless of age. The morning erection you notice when you wake up is simply the last one of the night, caught at the moment of waking. Here is why this matters clinically. Morning erections are your body's nightly vascular maintenance cycle. They deliver oxygenated blood to penile tissue, prevent fibrosis of the smooth muscle, and maintain the elasticity of the tunica albuginea, the fibrous sheath that holds an erection in place. A study from Boston University School of Medicine on 1,700 men found that men who reported 0 morning erections had a 4.2 times higher rate of severe erectile dysfunction within 3 years compared to men who reported regular morning erections. Morning erections are not a bonus. They are a biological necessity. When they disappear, your tissue is being deprived of its maintenance cycle, and the damage accumulates silently. Now here are the specific mistakes men make before bed that are shutting this system down. Mistake number 1, and this is the one that the research identifies as the most damaging by a significant margin, is screen exposure within 90 minutes of sleep. Specifically, the blue spectrum light emitted by phones, tablets, laptops, and televisions. The biological mechanism is this. Blue light suppresses melatonin production by up to 83%. This figure comes from a study at Harvard Medical School on 116 participants. But melatonin is not just a sleep hormone. Melatonin is a potent antioxidant that directly protects the endothelial cells of your blood vessels, including the penile arteries, from oxidative damage during the night. When melatonin is suppressed, 2 things happen simultaneously. First, your deep, slow-wave sleep is shortened, and 70% of your daily testosterone production occurs during slow-wave sleep. Second, the endothelial protection that melatonin provides is removed, meaning your penile vasculature is exposed to the oxidative stress of the night without its primary antioxidant defense. A study from the University of Chicago on 150 men measured the relationship between screen-disrupted sleep and morning erection frequency. Men whose melatonin was consistently suppressed by evening screen use reported morning erection loss at a rate 2.7 times higher than men who maintained darkness in the 90 minutes before sleep. 2.7 times. From a phone. The practical recommendation? Screens off 90 minutes before your target sleep time. Not dimmed. Not night mode. Off. If you cannot do 90 minutes, start with 60. The endothelial benefit begins within the first 2 weeks of consistent compliance. I want to tell you about Gary. He came to me at 63, fit, no significant medical history, morning erections completely gone for about 14 months. He had been told his testosterone was normal. It was 490 nanograms per deciliter and was given no further explanation. When I took a detailed evening history, I asked him, "What do you do in the last hour before sleep?" He said he watched TV in bed, usually fell asleep with it on, and checked his phone if he woke in the night. I told him, "Your penile tissue is going through the entire night without its maintenance cycle because your melatonin is being suppressed before it even begins." He looked at me like I'd said something impossible. We changed one thing: screens off by 9:30 p.m. 6 weeks later, he came back and said, "They're back. I didn't change anything else." That was the only variable. That single change restored what 14 months had taken away. Mistake number 2 is eating a heavy meal within 2 hours of sleep. The mechanism here is one that almost no one explains clearly. When you eat a large meal, particularly one high in refined carbohydrates or saturated fat, your body triggers a significant insulin response. Elevated insulin in the hours before sleep does 3 specific things that are toxic to morning erectile function. It suppresses growth hormone release, which occurs in the first deep sleep cycle and is required for tissue repair, including penile smooth muscle maintenance. It elevates triglycerides in the bloodstream, which directly impairs nitric oxide bioavailability in the endothelium. And it disrupts the hormonal cascade that prepares the parasympathetic nervous system for its nocturnal erection cycle. A study from the University of Adelaide on 960 men found that men who ate their largest meal within 2 hours of sleep had measurably lower peak nocturnal penile tumescence, measured by nocturnal penile tumescence monitoring, compared to men who ate their last meal 3 or more hours before sleep. The difference in tumescence quality was equivalent to approximately 8 years of vascular aging. 8 years. From meal timing alone. The practical recommendation is simple. Finish your last substantial meal at least 3 hours before sleep. If you are hungry in the evening, a small protein-based snack, a handful of nuts, some Greek yogurt, does not trigger the same insulin cascade and will not produce the same suppression. Mistake number 3 is drinking alcohol within 3 hours of sleep. I want to be precise here because most men have heard alcohol affects sleep and assumed it means they sleep less deeply. That is true, but it is not the primary mechanism by which alcohol destroys morning erections. The specific mechanism is suppression of REM sleep, and morning erections occur exclusively during REM sleep. A study from the Melbourne Sleep Disorders Center on 240 men measured REM sleep duration against alcohol consumption timing. Men who consumed 2 or more standard drinks within 3 hours of sleep showed REM suppression of 24% in the first half of the night, precisely the window when the majority of nocturnal erection cycles occur. Beyond REM suppression, alcohol is a direct vasodilator that causes a rebound vasoconstriction effect during sleep. As blood alcohol drops in the second half of the night, the sympathetic nervous system becomes hyperactive, producing exactly the adrenaline-driven smooth muscle contraction that prevents erection. The erection machinery is being blocked at the moment it is supposed to run its maintenance cycle. The research is clear. If morning erections are your goal, alcohol needs to stop at least 3 hours before sleep. And on nights when you want the system working optimally, none at all. Mistake number 4 is sleeping in a warm room. This one genuinely surprises almost every patient I tell it to. Core body temperature must drop by 1 to 2 degrees Fahrenheit to initiate and sustain deep, slow-wave sleep and REM sleep. When your bedroom is too warm, above 67 degrees Fahrenheit or about 19 degrees Celsius, your body cannot achieve the temperature drop required for these sleep stages. The consequence is lighter, more fragmented sleep with compressed REM cycles. A study from the National Institutes of Health on 800 adults found that sleeping in rooms above 70 degrees Fahrenheit reduced slow-wave sleep by 26% and REM sleep by 19% compared to sleeping at 65 degrees. This is not a small effect. This is the equivalent of losing nearly a quarter of your testosterone production window and a fifth of your nocturnal erection cycles every single night because your room is too warm. I want to tell you about Marcus. He came to me at 67, a retired engineer, meticulous about his health. Diet was excellent, he walked every morning, no alcohol, no smoking. Morning erections had been declining for 2 years, and he was frustrated because he felt he was doing everything right. When I asked about his sleep environment, he mentioned he and his wife preferred the room warm, around 72 to 73 degrees, especially in winter. I said, that single variable may be costing you 25% of your testosterone production and nearly 20% of your nocturnal erection cycles every night. We got him a cooling mattress pad for his side of the bed. 8 weeks later, his morning erections had returned with a consistency he hadn't experienced in years. He sent me a message that said, I feel like I got a decade back. One environmental change. Mistake number 5 is taking certain common supplements at the wrong time or taking the wrong supplements entirely for this specific goal. Most men over 60 who are aware of men's health supplementation are taking zinc, vitamin D, and perhaps magnesium. These are broadly correct choices, but the timing and the form matter far more than most men realize. Zinc is required for testosterone synthesis at the cellular level, specifically as a cofactor for the enzyme 17-beta-hydroxysteroid dehydrogenase, which catalyzes the final step of testosterone production. But zinc taken with calcium, common in multivitamins, is competitively absorbed. The calcium wins. The zinc is largely wasted. A study from the University of Texas on 88 men found that zinc taken separately from calcium, at least 2 hours apart, produced a 34% greater increase in serum zinc levels over 8 weeks compared to zinc taken concurrently with calcium. Take your zinc at night, separately, without a calcium source nearby. Magnesium, taken at night, reduces the level of sex hormone binding globulin, the protein that binds testosterone and renders it biologically inactive. Lower SHBG means more free testosterone available to drive the nocturnal erection cycle. A study from the University of Palermo on 399 men found that men with higher magnesium levels had significantly lower SHBG and higher free testosterone indices, independent of total testosterone. The form matters. Magnesium glycinate or magnesium threonate absorbs significantly better than magnesium oxide, which is the cheap form found in most supplements and absorbs at roughly 4%. Take 300 to 400 milligrams of magnesium glycinate 30 to 60 minutes before sleep. Vitamin D, and this is the mistake almost everyone makes, is a fat-soluble vitamin that must be taken with a fat-containing meal for proper absorption. Men who take vitamin D on an empty stomach or with a fat-free meal absorb as little as 30% of the dose. A study from the Cleveland Clinic on 180 patients found that vitamin D taken with the largest meal of the day produced 56% higher serum vitamin D levels compared to taking it on an empty stomach. Take your vitamin D with dinner, not in the morning with black coffee. Mistake number 6 is going to bed with unresolved psychological stress and doing nothing about it. I want to be clinically precise here because this is not about positive thinking. This is about cortisol biochemistry. When you go to bed with unresolved stress, work problems, financial pressure, relationship tension, your cortisol levels remain elevated into sleep. Cortisol and testosterone share the same biochemical precursor, pregnenolone. When cortisol production is high, it competes for and consumes pregnenolone, leaving less available for testosterone synthesis. This is called pregnenolone steal, and it is a documented biochemical mechanism, not a metaphor. A study from the American Endocrine Institute on 3,200 men found that men in high-stress occupations had testosterone levels 19% lower on average than demographically matched men in low-stress roles. And the suppression was most pronounced in the early morning measurement that reflects nocturnal production. Beyond the testosterone competition, elevated cortisol at sleep onset increases sympathetic nervous system tone throughout the night, the exact physiological state that prevents the parasympathetic activation required for nocturnal erections. Your body cannot run its maintenance cycle if it thinks you are under threat. The evidence-based intervention is not meditation, though meditation helps. It is a specific practice called a cognitive offload, sometimes called a worry dump. Research from Baylor University on 57 adults found that spending just 5 minutes writing a to-do list or writing down unresolved concerns before bed reduced sleep onset time by 37% and improved slow-wave sleep depth compared to controls. 5 minutes. A pen and paper. The act of externalizing the unresolved thought removes it from active processing and reduces its cortisol driving effect. Do this every night before you sleep. Mistake number 7, the final one and the most medically significant, is ignoring low-grade urinary symptoms at night and assuming they are just part of aging. Nocturia, waking to urinate 1 or more times per night, is present in approximately 60% of men over 60. Most men accept it. Most are wrong to do so. Here is the clinical reality. Every time you wake at night to urinate, you interrupt a sleep cycle. If the interruption occurs during REM sleep, you terminate a nocturnal erection event mid-cycle. Over time, this fragmentation accumulates. A study from the European Association of Urology on 4,100 men found that men with 2 or more nocturia episodes per night had a 58% higher rate of morning erection loss compared to men with 0 episodes, independent of age and testosterone level. But beyond the sleep fragmentation, nocturia is often a symptom of benign prostatic hyperplasia, or BPH, prostate enlargement, which compresses the urethra and irritates the bladder. The same inflammatory processes that drive BPH also drive vascular inflammation in the penile arteries. These conditions share a root cause, and treating nocturia medically often produces simultaneous improvement in erectile function. A study from the Journal of Urology on 2,800 men found that successful treatment of BPH-related nocturia improved morning erection frequency in 44% of cases, without any direct erectile treatment. If you are waking twice or more per night to urinate, do not accept this as normal. Ask your urologist specifically about BPH assessment and about alpha blocker therapy or 5-alpha reductase inhibitors if appropriate for your case. This is one of the highest yield interventions I make in clinical practice and one of the most underutilized. I want to tell you about Frank. He came to me at 68, having accepted 2 to 3 nocturia episodes per night for 4 years. His previous doctor had told him it was just aging. His morning erections had been absent for roughly the same 4 years. We assessed his prostate, moderately enlarged. We started him on an alpha-1 blocker. Within 6 weeks, nocturia dropped to 0 or 1 episode per night. His sleep architecture recovered. His morning erections returned. He came in for his follow-up and said, quietly, "I wish someone had told me 4 years ago that these two things were connected." I think about Frank often when I talk to men who have been told to simply accept what is happening to them. Here is your action plan in order of impact. First, screens off 90 minutes before sleep, starting tonight. This single change is reversible within 2 weeks and costs nothing. Second, last substantial meal 3 or more hours before sleep. Adjust your dinner time accordingly. Third, alcohol cutoff at least 3 hours before sleep. On nights when morning function is a priority, consider none. Fourth, cool your bedroom to between 65 and 67 degrees Fahrenheit, 18 to 19 degrees Celsius. Use a fan, open a window, or consider a cooling mattress solution. Fifth, Switch to magnesium glycinate 300 to 400 milligrams, taken 30 to 60 minutes before sleep. Take zinc separately from calcium. Move vitamin D to your largest fat-containing meal. Sixth, 5-minute cognitive offload before bed. Write down what is unresolved. Remove it from your brain's active processing queue. Seventh, if you wake twice or more per night to urinate, make an appointment this week for a prostate assessment. Do not accept nocturia as inevitable. I want to say this to you directly. Morning erections are not vanity. They are a biological signal, your body telling you that the vascular, hormonal, and neurological systems required for sexual function are working. When they disappear, the system is being suppressed. In most cases, the suppression is being caused by things happening in your own bedroom, in the hours before sleep, that you have full control over. You are not at the mercy of your age. You are at the mercy of your habits, and habits can change. Before you go, drop a comment right now and tell me, which of these 7 mistakes do you think has been affecting you the most? I genuinely want to know. And if this video gave you an explanation you've never been given before, share it with one man you know who needs to hear it. A friend, a brother, a colleague. They've probably been told to just accept it too. They deserve better than that. I'm Dr. Emily Carter. The research is unambiguous. Morning erections after 60 are not a luxury of youth. They are a biological function that your body is designed to maintain. And in most cases, what is stopping it is something you did before you turned off the light. Take care of yourself, and I'll see you in the next one.